Welcome to our presentation on chronic disease management education, and our presentation is on stroke. Our presenters from left to right are Raquel Gonzalez, Shikaya Morgan, Daniela Posada, Sarah Mavromatis, and Akira Stewart.
Hello, my name is Daniela Posada, and I'm going to briefly talk about the introduction of the disease. A stroke is when a blood supply does not reach all parts of the brain, causing damage to the brain tissue. This could happen due to a blockage, which would be called an ischemic stroke, or due to a blood vessel bursting, which in that case it would be called a hemorrhagic stroke. A stroke is a life-threatening condition, and effective and quick management can prevent long-term disability and potentially save a life.
Hi, I'm Shakaya Morgan, and I will be presenting on causes and modifiable risk factors of stroke. Stroke can be caused by, but not limited to, high blood pressure, arteriosclerosis, which is the buildup of fats and cholesterol in and under artery walls. Also, clotting disorders, heart defects, and brain aneurysm. Examples of heart defects are like atrial septal defects, hypoplastic left heart syndrome, pulmonary atresia, and tetralogy of Fallot. Some modifiable risk factors include hypertension, smoking, diet, alcohol consumption, and physical inactivity. These are examples that could change the way that the stroke occurs.
My name is Daniela Posada, and I will be mentioning some of the signs and symptoms for a stroke. Symptoms might happen sudden and with no known cause. Some of the symptoms include numbness, confusion, trouble seeing, trouble walking, and severe headache. An acronym used to detect a stroke is BFAST. B for balance. If you have loss of balance, headache, or dizziness. E for eyes, sudden loss of vision in one or both eyes. F for face. Does the person's face look uneven? A for arm, if you are experiencing arm weakness. S for speech difficulties. And T for time. If those symptoms are experienced, you must call 911.
Hello, my name is Akira Stewart, and I will be presenting on management and treatment of stroke. The first treatment that is used in treating a stroke is antiplatelet medication, and this type of medication stops the blood cells from sticking together and forming a clot. Also, stroke is treated with tissue plastinogen activator, which is known as TPA. This is where the blood restores the flow to the brain by breaking up blood clots, which makes the patient better. Anticoagulant medication is also used to treat patients with strokes. These are medications that prevent blood clot from forming in the brain. Thrombolytic therapy, this is a rapid diagnosis of a stroke, and the initiation of a thrombolytic therapy is within 3 hours of the patient getting that stroke. And the thrombolytic therapy, it works by dissolving the blood clot that is blocking the blood flow to the patient brain. Also, endovascular therapy is also a treatment that is used to treat patients with strokes, and this is where a stent is placed inside the blood vessels that prevent blood from flowing into an aneurysm. An aneurysm, this is an abnormal swelling or a bulge of a blood vessel. Lastly, antihypertensive medication, which is known as high blood pressure medication. These type of medication is given to the patients to help control their blood pressure to prevent any blood clots inside the patient brain or to prevent any damage to any vessel inside the patient brain.
This is Sarah Mavromatis, the student nurse. The best way to help prevent a stroke is to eat a healthy diet, exercise regularly, and avoid smoking and drinking too much alcohol. These lifestyle changes can reduce your risk of problems like arteries becoming clogged with fatty substances. and also by preventing atherosclerosis, high blood pressure, and high cholesterol level. Someone that have had a stroke can reduce the risk of having another stroke in the future simply by making these changes. Advent Health Creation Life principle emphasizes the importance of making some changes for better living. The choice principle indicates that you are in charge of your destiny. The first step toward wholeness is realizing you're in control of your life. The nutrition principle suggests making small changes in your diet, which would make a big impact on your health. Have a balanced diet. Don't eat too much of single food, especially food high in salt and the processed food. Salt has to be limited to 6 grams a day. A healthy diet and regular exercise is the best way to maintain a healthy lifestyle. For most people, the recommendation is 150 minutes a week of moderate aerobic activity. If you recently have had a stroke, please discuss these exercise plans with the rehabilitation and your provider team. Smoking can narrow the arteries and you will have a higher risk of blood clot. Therefore, no smoking can help reduce the chance of a stroke. No smoking will improve general health and reduce the risk of other serious conditions. Cut down on alcohol. Alcohol drinks are high in calories and could cause weight gain and also triggers to irregular heartbeat. Heavy drinking would multiply the risk of a stroke. If your provider allows it and you decide to drink alcohol, try to not exceed the recommendation limit.
My name is Raquel Gonzalez, and I will be presenting the slide on preventative measures. Primary prevention. You want to get active. Moderate exercise for 30 minutes 3 times a week. Healthy eating. This includes whole grains, heart-healthy fats such as olive oil and avocado oil. Fruits and vegetables should be integrated into your everyday meals. Quit smoking. Drink alcohol in moderation. For our secondary prevention, we are going to manage high blood pressure, lower your cholesterol. If you are on blood pressure medication, make sure you take it as directed, as well as the cholesterol medication needs to be taken as directed. And we also need to manage your diabetes. Diabetes should be following a diabetic diet, as well as all instructions from your endocrinologist. And make sure to check your blood sugar levels. Tertiary prevention. Once you have had a stroke, take aspirin as directed. Follow all instructions from your provider. Also, attend support meetings. If you have a problem with alcohol, there's Alcoholics Anonymous and drug rehabilitation programs if there is an issue with drugs. This is Raquel Gonzalez, and I will be speaking about preventative measures, activities for a healthy heart. Bike riding and Tai Chi are fun and great ways to get some exercise. Walking and swimming are great ways to keep your heart healthy. All of these exercises can be done as a family. This is Raquel Gonzalez, and in this slide I will offer some tips for support and resources. For heart healthy recipes, you may go to the American Heart Association. There are tasty recipes and recipe ideas for heart healthy foods. I've also included a link from the American Stroke Association with information in Spanish if that is more comfortable. There's also a link to the American Stroke Association for family and caregivers of people who have had a stroke. There is also a link about taking your medication from the American Stroke Association. And finally, there is a link with exercise ideas and exercise examples from the American Stroke Association.